Welcome to Toledo Clinic TV. Our guest for this segment is Dr. Amanda Nahhas, a board-certified dermatologist. Thank you for being with us.
Thanks for having me.
Of course, you want people to come to you when they notice something that might be suspicious. And that's what we think about when we think about dermatology, is just the surface things. How important is it that you get those annual screenings?
Well, just like having your mammogram, your annual blood work, all these other important cancer screenings that our primary cares are doing. The skin does sometimes get forgotten, and a skin cancer screen can sometimes save your life. So, recognize if you have a bad mole or a mole you're worried about, it's changing. I always want patients to bring those to my attention because it's usually worth getting it checked first, and at least so you're not worrying about it and have a little peace of mind. And then also, if it needs any intervention, catching it early, and preventing any long-term issues associated with it.
Have you seen an increase in skin cancers in recent years?
We're doing a better job at counseling patients on avoiding tanning, things like tanning bed use. So we are seeing that our younger populations are more aware and avoiding those previous habits, but still it is a growing type of skin cancer, and so we try to catch it early. Patients who have a family history, especially first-degree relative with melanoma, which is one of the more serious skin cancers we worry about just because it spreads quickly and it can shorten your lifespan if not caught early. For that patient population, I do recommend a skin cancer screen at least once a year.
And at what age should you start doing those?
It's variable. I would say usually most of my patients start coming in their 20s and 30s, especially if there's any family history. But I have younger patients that I'll screen as well, especially if there is a family history of melanoma.
And so if a patient comes in and there's something suspicious, what's your first step? You're just taking a look at it on the surface level? Might it be something that's a little more invasive to do a biopsy?
Yeah, so usually we'll take a look at it, see if it has any suspicious just with the naked eye. But we do use the assistance of dermoscopy, which is just a special light device that magnifies the mole and just lets us see some of the mole architecture. And we're just looking for any suspicious abnormal patterns. And if that mole is found to be suspicious enough, I would recommend a biopsy. So there's a couple ways we do it. Sometimes we'll just numb it and do a little light shave, just really superficial, or we'll remove it with a stitch. And then we just wait for the pathology results and kind of go from there.
Do you find that people are reluctant to visit when there's something that's suspicious because they're scared about what the outcome might be?
Yeah, absolutely. But I would say usually if they haven't come to me on their own, it's usually their partner or a family member that's pushing them to come in and get it checked.
All right, good advice. Thank you so much. Thanks for being with us.
Thank you.
And thank you for watching.